Tonight, as COVID cases surge across the country, mostly among the unvaccinated, the strain on our healthcare system and our frontline workers as bad as it's ever been. Some states are having to limit capacity at hospitals because staffing levels are so low. And tonight, there is real concern about burnout. Our Ariel Reshef reports.
On the front lines of a seemingly unrelenting pandemic, tonight healthcare workers are stretched thin, nearing a breaking point.
I think our biggest need right now is nursing staff. We are very short of nursing staff.
Nurses in hospitals across the country are finding themselves overworked and emotionally drained.
Where I might only see one death in one of my shifts, like maybe every week, maybe every other week, I was seeing multiple deaths a night.
According to Health and Human Services, more than 80,000 people are now hospitalized across the country. There are less and less ICU beds available. ABC's Victor Oquendo reporting from the University of Florida.
Of course, if you create more ICU bed, you need trained ICU nurses.
The challenge now facing hospitals is more than just finding beds for patients. They need to find people to treat them, too.
We were thin already. We had lost a number of staff over the course of 2020, and we've been working hard to replace those. So we're thinner than ever before, and this is obviously putting a real strain on the system.
Celebrated as heroes, it's easy to forget the devastating impact the pandemic has had on nurses and doctors.
I have no idea how to help my own nurses anymore. They're leaving the profession. They're leaving their job. And we need to have a solution. We need to end this.
Jennifer Steenberg is the intensive care unit nursing supervisor at Memorial Hermann Southwest Hospital in Houston. She's begging for more help.
I don't see an end in sight. I am now seeing that the sky is falling, and I'm really trying hard not to be that person. But I've done this now for 18, 20 months. And I don't see a way out. That vaccine was our way out, and we're losing our grip on that.
All across the country, including the hard-hit South, where vaccination rates are the lowest, there is an increasing demand for more nurses and more medical staff. In Mississippi, where vaccination rates are only 36%, the same story.
It is exhausting. We spend a week in the ICU per intensivist, and by the end of that week, we are completely drained both emotionally and physically. We work in a team with our nurse practitioners, and so are they. But more than anything else, it's our nurses and the respiratory therapists who basically do this day in and day out, and I'm actually more worried about them.
For nurses like Paulette Rangel, it got to be too much.
As much as we threw at them as far as treatments and medication and things like that, there was just not enough that we could do to save some of them.
Rangel was a nurse for 9 years, 7 in intensive care. She was named Arizona's Nurse of the Year in 2015 by the March of Dimes organization.
You know what the right thing to do is, and you're doing everything that you can for these patients, but ultimately, all of those things are out of your control, and that really just, it changes you.
There was no single tipping point, but she says the unending stream of patients for what is now a preventable illness wore her down.
I went over to my supervisor and asked if I could step down, to fewer work days. And I was denied because we didn't have enough staff.
Paulette left her job last week.
And that just wasn't something that I could handle anymore. And so I made the decision to leave.
Taking a position instead as a supervisor with a local nonprofit administering vaccines.
You just get so mad. You have this anger towards the system and having to suffer through this and what you feel like is alone, and nobody understands what we go through.
A statement released by the Florida Hospital Association says 3 out of 4 hospitals there are facing nursing shortages. Mississippi's governor addressing the challenges at a press conference Friday, saying the state has lost 2,000 healthcare professionals in the last year.
Our challenge is much less about the physical aspect of hospital beds or the physical aspect of ICU beds, and it's much more about actually staffing them.
As officials wait for assistance, they're turning to traveling nurses to help fill the staffing gaps. In Texas, 2,500 medical personnel are on the way to relieve hospital workers being pushed to the limit.
Because we have so much less staff, the patient to nurse and doctor ratio is the worst it's ever been.
With so many hospitals nearing a breaking point, nurses like Rangel not ruling out helping their colleagues again.
I loved my job. I absolutely loved it. I just wasn't in the mental state to be able to properly care for my patients in the way that they deserved.
Ariel Reshef, ABC News, New York.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.